Hi everyone, I'm Dr. Philip Rosen, and today we're going to be talking about hemorrhoids. More specifically, what are hemorrhoids and how do we treat them? Here's a picture of the digestive system. When people talk about hemorrhoids, the problem is in the anus or in the rectum. Hemorrhoid is simply the medical term for an anal or rectal vein. That's all they are. Hemorrhoids are veins. In fact, hemorrhoids are a normal part of anatomy. Normally, hemorrhoids are small and flat, like on the left. And when they're small and flat, we never notice them. But when they become swollen, like on the right, they can cause problems, such as bleeding, pain, burning, itching, or they can even pop out during or after bowel movements. The problem isn't the hemorrhoid itself, it's the swelling of the hemorrhoid that causes problems. So what causes hemorrhoids to swell and start causing problems? There are two main causes of hemorrhoidal swelling: chronic constipation and excessive pushing. Both of these increase blood flow to the hemorrhoids and result in chronic swelling. So how do you treat swollen and problematic hemorrhoids? For most patients, the answer is straightforward. Fix the constipation to reduce the hemorrhoidal swelling. For most patients, adding fiber in your diet will reduce the constipation, reduce the straining, reduce the swelling, and stop the bleeding, pain, burning, and itching. In fact, the majority of hemorrhoids improve with fixing the constipation alone. Most patients do not need procedures or surgery. It's worth repeating. Most patients do not require procedures or surgery to treat their swollen hemorrhoids. What about hemorrhoid creams or suppositories, such as Preparation H, witch hazel, hydrocortisone, lidocaine? They're okay to use. They may temporarily help with itching and irritation, but they won't fix the underlying problem, which is the swelling of the hemorrhoids. In summary, increased fiber will lead to improved constipation, reduced swelling, and less bleeding, itching, burning, and other hemorrhoid problems. But what if fixing the constipation isn't enough? What if you continue to have symptoms despite increased fiber and water intake? Patients often tell me, "I've tried the fiber, but my hemorrhoids aren't getting better. What now? Are there procedures that can help?" When fiber isn't enough, I offer pain-free, minimally invasive office-based procedures. This way, you can return to your life as quickly as possible. In the office, I can do pain-free rubber band ligation, or banding is another name for it. In addition, I can do office-based injection sclerotherapy. After these office procedures, you go home the same day and can return to work the next day. My goal is for you to return to your life as quickly as possible. And for the most severe cases, when office-based procedures are insufficient, I can offer minimally invasive surgery in the operating room, such as hemorrhoidectomy, PPH, or THD. In summary, there are three primary ways to treat hemorrhoids. Number one, fiber. This alone fixes most hemorrhoids. 2, pain-free office-based procedures. And 3, minimally invasive surgery. If you're curious, I went to medical school at the University of Pennsylvania, did my training at SUNY Downstate in Brooklyn, New York. I did my surgical fellowship at the Colon and Rectal Clinic of Orlando in Orlando, Florida. And yes, I accept most major insurances. For more information or to schedule an appointment, please call my office, 516-608-6848. Again, 516-608-6848. 6848.